Robin Hood Radio presents Your Health with osteopathic physician Dr. Kim Tripp, a show presented monthly on Robin Hood Radio, discussing the challenges faced and the solutions that are available for keeping vital health and well-being throughout our lives. And now, here's Dr. Tripp.
Hello, everyone. Welcome to Your Health with Dr. Kim Tripp, osteopathic physician. This is the health show created to bring you vital information and discussion of all kinds of health issues on your mind and in your life from the unique perspective of traditional osteopathic medicine. So first, let's clarify what osteopathic medicine means, as we do for our new listeners each time. Osteopathic medicine is practiced by fully licensed physicians in the United States with a D.O. degree, a Doctor of Osteopathic Medicine degree. Our practice is based on the essential relationship in all living things between structure and function. In other words, the natural interdependence between anatomy and physiology, or that between the physics of the body and its chemistry. As osteopathic physicians, we use our comprehensive and precisely detailed knowledge of anatomy and physiology to promote health and healing in our patients. We work gently with our hands to help your body restore optimal function based on optimal structure. Our medical specialty is therefore called osteopathic manual medicine, as in hands. We receive uniquely in-depth training in anatomy and physiology and their relationship within your body in the context of a full physician's medical training. Only U.S.-trained osteopaths are fully licensed physicians and have all of the current medical pharmacopoeia, nutritional science, and full medical training at our disposal. This means that your individual treatment may include a wide range of approaches, but it will always be founded on our gentle, hands-on work. We practice from the unique perspective of first looking for the health in our patients, rather than merely finding illness and disease. Our practice has been especially effective for, but is not limited to, musculoskeletal and other structural issues, as well as problems like chronic headache, gastrointestinal disease, post-concussive syndrome, sleep disturbance, allergies, and many, many other health problems. We work together with you, the patient, to help you build health and vitality in your body, mind, and spirit as the solution for health problems, rather than only treating the disease symptoms. So in the radio show, we tackle health issues from this point of view. What can we do to help you build your health and vitality in order to prevent and heal injuries and disease? And we do that by giving you some basic information about the problem to help you understand what is happening, as well as to offer solutions and guidance for helping yourself to heal and stay healthy based on our clinical experience with patients in our practice. Before we get started on today's topic, let me remind you that you can listen to all of the prior Your Health shows online at your convenience, such as the shows on back pain, nutrition, carpal tunnel, concussion, and allergies, by going to Robin Hood Radio's website, then the On-Demand section, scroll down and select the Your Health shows, or by going to the www.goldman.net website, where they are all listed alphabetically when you click on the radio show icon. Today, we are going to finish up our series on the lungs and breathing by delving back into the thoracic diaphragm, that unique muscle that spans our chest at the bottom of our ribs and makes it possible for us to breathe. We generally refer to the thoracic diaphragm, that is thoracic as in thorax as in chest, as the diaphragm. But it's important to realize that there are other diaphragms in the body, including the pelvic diaphragm. But for now, for today, when we say the diaphragm, we're referring to the thoracic diaphragm in our chest. The term diaphragm in general means a thin, dividing membrane from the Greek and Latin roots, and we apply the term to various specific uses. Anatomically, the thoracic diaphragm is a thin sheet of strong muscle extending across the thoracic cavity, separating the abdomen, our belly, which contains the GI system, among other things, from the thorax, our chest, which is surrounded by ribs and contains the heart and lungs, among other important organs. Let's spend some time on the anatomy and function of this amazing diaphragm that makes it possible for us to breathe, but also plays other roles in our body as well. The diaphragm is a thin sheet of muscle at the bottom of the ribs, spanning the entire chest cavity and doming up into the cavity under the heart and lungs like a parachute or upside-down bowl. It serves as the bottom of the chest cavity and the top of the abdominal cavity, separating the abdominal contents from the chest cavity contents. As a continuous sheet of muscle, the diaphragm attaches in its own middle to a central tendon that strengthens and stabilizes the muscle as it contracts, moving down into the bottom of its range as we breathe in, and relaxes back up into the topmost domed position of its range as we breathe out. The central tendon actually fuses with the bottom of the fibrous sleeve surrounding the heart, called the pericardium, such that the heart rests on the diaphragm and is gently raised and lowered with each breath in and out. The diaphragm is also in direct contact with a number of other organs, and we'll talk about that shortly. The diaphragm attaches all along its rim to the ribs and vertebrae of the lumbar spine in the back, and to the little cartilaginous bump at the bottom of the sternum, which is your breastbone, called the xiphoid process, which does actually change to bone as people age. The diaphragm is tethered, if you will, like any parachute, to the upper lumbar vertebrae and the lowest 12th ribs through a set of ligaments called the arcuate ligaments, as well as by two tendinous attachments called the right and left crews, which are extensions of the diaphragm muscle fiber tissue, and they attach along the upper lumbar spine. The diaphragm has three large openings through its tissue to accommodate: 1, the esophagus passing through to the stomach through the esophageal hiatus; 2, the great aorta artery passing through the aortic hiatus to the abdomen as it carries oxygenated blood from the heart to the lower body; and 3, the inferior vena cava, passing up through the diaphragm to the heart. This is the large vein that returns deoxygenated blood from the lower body back to the heart. In addition to these three large openings, there are numerous tiny openings scattered across the diaphragm called stomata. Yes, that's the same word that we use for the tiny openings on the bottom of leaves. These stomata in the diaphragm allow for lymph and other fluid exchange between the abdomen and the thorax and are very important for normal lymphatic function and fluid management in the abdomen. There are several abdominal and thoracic organs which lie in contact with the diaphragm: the heart, lungs, liver, stomach, spleen, pancreas, kidneys, and esophagus are directly and positively influenced by the rhythmic contraction and relaxation of the diaphragm during breathing, which aids circulation and lymphatic flow, which is so important for immune function and the health of all these vital organs. The diaphragm, like the heart, is one of the most important muscles in the body for survival. Its remarkable design and function allow us to breathe. In order to inhale, the diaphragm must contract and lower toward the abdomen and flatten. This allows for pressure to change in the thorax that allows the lungs to fill with air. In order to exhale, the diaphragm then relaxes, domes up, and helps the deoxygenated air to be released from the lungs. If the diaphragm doesn't function, we can't breathe. The diaphragm is controlled by both voluntary and involuntary physiology. Most of the time, the diaphragm functions involuntarily. We are not consciously controlling exactly how we inhale and exhale. However, we do have a certain degree of voluntary control, which we use when we are consciously controlling our breathing, including when we hold our breath, although it becomes increasingly difficult to assert voluntary control of the diaphragm the longer we hold our breath. Breathing is a very strong primary drive. The diaphragm also helps to create our cough reflex in response to irritants or congestion in the airways. During a cough, the diaphragm is first stimulated to create a large inhalation by dropping. Then our epiglottis closes, so pressure builds up in the lungs. And finally, the diaphragm moves into exhalation while the chest wall muscles contract, expelling the air very rapidly through the open airways at speeds approaching 100 miles an hour, which clears the airways out. This is an essential function to help heal and prevent respiratory disease and airway damage. The diaphragm is controlled primarily by the phrenic and lower intercostal nerves, nerves that travel between our ribs. It's in communication with the brainstem, which controls involuntary life support functions like breathing. The right and left phrenic nerves emerge from the spinal cord on both sides of the spine from 3 of the middle neck vertebrae, C3, C4, C5, the 3rd, 4th, and 5th cervical vertebrae. The left and right phrenic nerves then travel down to the diaphragm and control the contraction of the muscle sheet in relation to impulses from the brain stem or from the cerebral cortex, which controls voluntary impulses. Damage to the phrenic nerve interrupts diaphragm function and hence breathing. Since the diaphragm is a muscle, it can spasm, i.e., reflexively and repeatedly contract, and that gives us the hiccups. But additionally, there is another crucial innervation from the vagus nerve. The esophageal hiatus is created by the 2 slips of muscle and tendon that surround the hiatus and attach to the lumbar spine called the crura. Remember that? There is a right crus and a left crus. The right crus twists around itself and creates the opening for the esophagus. It turns out that all-important vagus nerve, which is the nerve that controls the heart pace, GI function, breathing rate, and many other parasympathetic nerve responses, also controls the contraction and relaxation of the esophageal opening through the right crus muscle fibers of the diaphragm. So anything that irritates the vagus nerve as it travels from the brain to the esophageal hiatus can lead to issues with the diaphragm. So, what can go wrong with this amazing muscle? There are different types of diaphragm problems that can be basically considered as anatomic or neurologic, and that may be caused in either case by congenital defects, trauma, or disease. Some of the more common or critical problems include congenital hernias, which occur where the diaphragm does not completely develop, allowing abdominal contents to push into the thorax, and which also then leads to breathing difficulties. In such a case, respiratory distress and or cyanosis, which is a bluish discoloration of the skin resulting from poor circulation or inadequate oxygenation of the blood, may occur within the first 24 hours of life. If the defect is small enough, patients often remain asymptomatic for years or even decades. For major defects, surgical repair is necessary. The more common hiatal hernias can be caused by diaphragm dysfunction of many sorts. Recall that the esophagus passes through that opening in the diaphragm called the esophageal hiatus, logically enough, below which it connects with the stomach through the stomach's entry tube, which is called the cardia. The esophageal hiatus is created and regulated by the right crus of the diaphragm, whose tone, in part, keeps the stomach contents and acid from regurgitating back up the esophagus and causing acid reflux. Also recall that a hiatal hernia occurs when a part of the stomach slides up through the esophageal hiatus where it doesn't belong, contributing to acid reflux every time the diaphragm contracts. If the esophageal hiatus relaxes normally during swallowing and then tightens again after the swallow, we can swallow food, which can then pass easily into the stomach through the non-restrictive hiatus. If the hiatus is permanently contracted, in other words, not relaxing during a swallow, it continually prevents easy passage of food down the esophagus. Normal relaxation of the hiatus diaphragm fibers during swallowing followed by restoration of a normal tighter tone, allows for normal swallowing but prevents regurgitation of stomach contents back up into the esophagus after the swallow. So if the diaphragm tone maintenance is not working properly, we can more easily develop a hiatal hernia and reflux issues. Traumatic rupture or tearing occurs where the diaphragm muscle or other tissue is pierced or torn by weapons or blunt force. Initially, depending on the severity of the injury, such injuries can give abdominal pain, respiratory distress, and even cardiac dysfunction. Remember that close relationship between the diaphragm and the heart. Later symptoms include gastrointestinal complaints, pain in the left upper quadrant or the chest, pain in the left shoulder, shortness of breath, and inability to take a deep breath. GI symptoms can be severe, with nausea and vomiting, with unrelenting abdominal pain and respiratory distress. Any disease or injury that impacts the brainstem, vagus, or phrenic nerves can lead to life-threatening interruption of diaphragm function and thus breathing. One of the reasons why all trauma victims are placed in a cervical collar at the scene of the accident is to avoid spinal cord injury, but also to avoid phrenic nerve injury. Any injury to the phrenic nerve can threaten diaphragm function and breathing. Neurological and muscular degenerative diseases like ALS, myasthenia gravis, polio, muscular dystrophy, multiple sclerosis, and even temporary paralysis syndromes or diseases like Guillain-Barré can lead to diaphragm dysfunction depending on disease progress and severity. Stroke, surgical trauma, radiation therapy, post-viral neuropathy, or tumors all can lead to diaphragm dysfunction through interruption of nerve signal to that great muscle. If the diaphragm becomes paralyzed on one side through trauma or disease, the person may not feel any major symptoms, but will likely feel some shortness of breath with exertion, general fatigue, some chest wall pain or pressure, and can be especially short of breath when lying with the paralyzed side down. On the other hand, if the diaphragm is completely paralyzed, they will feel extreme shortness of breath with even minor exertion and will not be able to breathe while lying down. Distressed breathing can be a very serious problem that must be addressed immediately. Call 911 or get to the ER if this occurs. However, it's also important to realize that our diaphragm need not be severely injured or diseased to be suboptimally functioning and thereby limiting full excursion of inhalation and exhalation, thereby also leaving us with suboptimal respiration and suboptimal oxygenation. This can lead to fatigue, incomplete clearing of mucus and other airway irritants, and increased susceptibility to allergies, asthma, or colds, as well as incomplete lymphatic function. Remember all those organs that are in contact with the diaphragm that benefit from its rhythmic movement. There are any number of musculoskeletal injuries and restrictions that can impair diaphragm excursion as well, leading to suboptimal breathing. Any rib, neck, or back tension or restrictions can translate to diaphragm restriction. Recall where the diaphragm attaches and where its controlling nerves originate. Like any muscle, even slight restrictions of circulation or nervous impulses can reduce the diaphragm's optimal function. And this relationship can work reciprocally as well. Recall that diaphragm attaches to the upper lumbar vertebrae. Anything that restricts diaphragm full range of motion can lead to chronic back, rib, neck, or shoulder pain, as well as postural compromise from chronic drag on the back from a contracted diaphragm. So what can we do to heal diaphragm injury, disease, or dysfunction? Well, we know that major trauma may need corrective surgery, and neurodegenerative diseases will all each have their specific plans of treatment. Less severe dysfunctions can be treated with rest and osteopathic treatment to include eventual reconditioning of the diaphragm through breathing and general conditioning exercises. Osteopathic treatment of the diaphragm may also lead to relief of other chronic conditions such as gastrointestinal reflux, neck, or back pain. Osteopathic treatment can be an excellent, sustainable approach to help with diaphragm and thoracic problems, to restore normal and full diaphragm range of motion, relieve muscle strain and spasm, alleviate pain and inflammation, restore full range of motion to all the ribs, sternum, and associated tissues. An expert osteopathic physician who is a specialist in osteopathic manual medicine can be especially helpful for diaphragm issues. An osteopathic physician who is a specialist in osteopathic manual medicine knows how to work gently and in detail with the intricate and extraordinary structures of your thorax, ribs, diaphragm, upper back, and chest, working with the bones, muscles, ligaments, tendons, and fascias to relieve inflammation and pain, improve range of motion of bones and muscles, optimize circulation and lymphatic drainage, and help your body restore your diaphragm, ribs, sternum, chest, and all the associated tissues to optimal structure and function, not only helping to relieve problems, but also helping to prevent them. In addition to regular osteopathic treatment, here are some important tips for preventing injury and maintaining good health for your diaphragm, ribs, and thorax. Always gently stretch your chest, neck, and upper back before and after exercise or other strenuous physical activity. Practice deep breathing and neck and shoulder mobilizing exercises regularly to help keep diaphragm, ribs, and thoracic muscles moving freely. Use proper technique and equipment that is the appropriate size and weight for you. Make sure that your sports, construction, maintenance, and repair activities are not straining or forcing your neck, back, and chest, and follow good body mechanics in all your activities. Don't try to lift heavy weights that are too heavy for your own individual conditioning to avoid straining your neck, diaphragm, and chest wall muscles, including household items and furniture. Stay well hydrated to keep tissues flexible and healthy. So to review, through the diaphragm's attachments to the lumbar spine, ribs, and sternum, its integration with the thorax and shoulders, head, and neck, and through its functional relationships with breathing, the heart, lungs, liver, and other organs, the diaphragm serves as a central fulcrum for all the work of the body. Diaphragm problems and reduced function can come on at any stage of life, even without an injury. There are less common and more medically serious causes of diaphragm dysfunction that are associated with breathing difficulties and chest pain that can accompany cardiac problems, as well as a daunting number of possible causes of thoracic pain in this complex area. So, shortness of breath, rib, or thoracic pain should always be examined by a physician well trained in musculoskeletal health. Any sudden changes in breathing ability need immediate emergency medical attention. Osteopathy is practiced by osteopathic physicians who are specialists in osteopathic manual medicine, can relieve the initial pain and symptoms and make a real difference in helping to optimize structure and function in the diaphragm, ribs, upper back, shoulders, chest, and neck, and therefore in resolving and preventing these issues with gentle, precise, hands-on work. Well, that was a lot of information, and that's all we have time for today. So I want to thank you so much for your attention to Your Health with Dr. Kim Tripp. Remember, you can email your comments and suggestions for topics to yourhealth@robinhoodradio.com. If you have a health issue yourself and would like to find out about how we might be able to help you in our practice of traditional osteopathy, we're at our offices in Sharon, Connecticut. Dr. Kim Tripp and Dr. Andrew Goldman, Goldman Tripp, Osteopathic Healthcare, 860-364-5990, Monday to Friday, 8:45 a.m. to 5 p.m. with evening hours on Wednesdays and Fridays, or on the web at www.goldmantripp.net. I'll be looking forward to being with you next time. Meanwhile, take care of yourself Enjoy your health, take a good deep breath, and thank you for listening.